Hello students, this is Dr. Madhan Kumar, Assistant Professor from the Department of Conservative Dentistry and Endodontics from Vinayaga Missions Sankaracharya Dental College and Hospital. Today we will be covering the topic of instrument separation and its management. We will be covering under the following contents: introduction, the classification of procedural errors, incidence of instrument separation, the various causes of instrument separation, what is the mechanism of instrument fracture, the factors that influence the broken instrument retrieval and management of separated instruments, and how to prevent the breakage of instruments, and we will be concluding with the take home messages. Coming to the introduction, endodontic mishaps are procedural errors that are unfortunate occurrences that happen during the treatment. The recognition of such errors is the first step in rectifying such errors and providing a further prognosis of the complaint. Correction of a mishap is always accomplished in one or several ways depending upon the type and the area of the mishap that has been happened. Coming to the classification of procedural errors given by Grossman, it is given according to the procedures that we carried out throughout the root canal procedures, which is accordingly to related to access opening procedures, related to the cleaning and shaping procedures, and related to obturation procedures. Related to the access opening procedures of the pulp space, the mishap that can be happened can be due to treating the wrong tooth or incomplete removal of caries. It may be a perforation or iatrogenic causes, and the access opening through a full coverage restoration is always a difficulty compared to the access opening in a natural tooth. And the second one is related to canal shaping and cleaning. You can end up in canal blockage or ledge formation or deviating from the normal anatomy, the separation of instruments and obstruction by previous any restorative material that has been placed or a foreign object. And the third one is the related to obturation. You can either end up in underfilling of the root canal space or overfilling of the root canal space, which both of them is dangerous to the success of the root canal system. Coming to the topic of the day, that is instrument separation. There is no endodontist who has not done an instrument separation. What is this instrument separation is? It is an intracanal separation of the endodontic instrument. Infrequently occurs during a root canal therapy. When separation or fragmentation occurs, the large instrument within the pulp canal it blocks the proper cleaning and shaping, further resulting in the in decreasing the prognosis of the root canal treatment. The most common causes are the improper use of the instrument, proper assessing of the radiograph, inadequate access, the difference in root canal anatomy, and possibly the manufacturing defects of the instrument. Coming to the incidence of the root canal instrument separation, it is more commonly in molars than anteriors. Why it is more commonly in molars than anteriors is the root canal anatomy of molars is more complicated than the anterior or the single rooted teeth, and especially the mesial roots of mandibular molars are more susceptible to instrument fracture, and the instrument separation incidence is about 5%. And then you can ask me a question that whether rotary file will break or a hand file will break. The hand file separation is about 0.25%, whereas the rotary file breakage causes between 1.68% to 2.4%. Coming to the various causes of instrument separation, for any procedural errors to happen, there should be some causes that has been happening by the clinician and also from the patient aspect. That is improper use or overuse of the endodontic instrument, the type of tooth which we are using, an inadequate access, too much of radicular pressure when the cyclic fatigue increases and the torsional fatigue increases, and due to inexperience of the operator, the rotational speed which is not set according to the manufacturer's instructions, and any canal curvatures, any absence in glide path, and any torque setting mishappening will all result in the instrument separation. Instrument separation is not a procedural error because only one etiology. It is a combination of 4 or 5 etiology which will result in the instrument separation. The main mechanism behind instrument fracture is these two things, that is cyclic fatigue and the torsional fatigue. Cyclic fatigue is nothing but a repetitive compressive and tensile stresses acting on the outer portion of the file rotating in a curved canal that is leading to a cyclic failure without the previous signs of plastic deformation. The file does not show any signs of deformation when the file is subjected to a cyclic fatigue. Cyclic fatigue is nothing but the compressive and the tensile stresses simultaneously happening inside a curved root canal anatomy. Whereas what is torsional failure? Torsional failure is nothing but in cases of, let us assume that it is in a narrow canal scenario, only the tip of the instrument binds to the narrowest part, whereas the tip of the file is binded to the canal, and the shank of the file is continued to rotating by the handpiece that we are using. So torsional fatigue happens, resulting in the breakage of the instrument. So these are the two mechanisms by which the instrument fractures, that is cyclic fatigue and torsional fatigue. Coming to the management of separated instrument. Instrument separation is an accident that happens in our daily day-to-day practice, clinical practice, whereas the management should also happen in such a way that it is also a part of our daily clinical practice. So there are various number of devices, technologies, techniques are reported for the removal of an instrument obstruction or any foreign object. So the main technologies or instruments that are available for a instrument separation removal are ultrasonic method and the microtube method. According to Cohen, he is classifying the treatment options into two types, either non-surgical approach or a surgical approach. But according to Grossman, he says that there are only three options, that is either retrieving the instrument or bypassing the instrument or a surgical intervention in the form of hemisection, apisection in cases of apical third instrument separation. What are the various factors that influence in broken instrument removal? For how there is etiological causes for an instrument to fracture, there is also certain factors that will prevent the separated instrument to be removed from the canal. It can be a tooth factor, or what type of instrument has been fractured, or an operator factor or a patient factor. The various tooth factors are the type of tooth, anterior or a posterior. When an instrument is separated in an anterior tooth, it is comparatively more easier to retrieve than in the posterior tooth. And similarly in maxilla and mandible has more curvy roots, and mandibular mesial roots are very difficult to remove any foreign objects that has been separated in the mesial roots of the mandibular molar. And coming to the root canal anatomy, a normal straight root is always easy for an instrument retrieval, whereas a curved root or a narrow canal will have certain obstructions for the removal of the broken instrument. And for the location, depending upon the location of the separated fragment, when the fragment is at the coronal or the middle third before the curvature starts, the possibility of removing the instrument is more easier than removing in the apical most part beyond the curvature. And depending upon the circumference of the canal and the thickness of dentine, the prognosis of the instrument separation removal will depend upon. And depending upon the separated instrument factor, the type of instrument that has been fractured, whether it is a K file or a H file, depending upon the alloy material, depending on the diameter, length and position in canal. And when the instrument is getting fractured, like after your complete cleaning and shaping procedure is over, the last instrument getting fractured, and whether it is the first instrument that you are using is getting fractured. And depending upon the size of the instrument, a smaller size instrument is difficult to retrieve, whereas an instrument of bigger size is comparatively easier to retrieve. Coming to the operator factor, even though all factors come in line, the operator should have his own knowledge, techniques, and proper patience is more important in cases of an instrument separation removal. Coming to the, even though the doctor is okay to remove the instrument, the patient cooperation is very, very important, and educating the patient and creating awareness in the patient for this instrument separation removal is more important, so that you get the complete cooperation of the patient for this instrument retrieval. Coming to the location of the instrument, coronal, middle or apical, it may be the instrument fractured will be in these three segments. The coronal and middle are comparatively easier to try for an instrument retrieval, whereas the apical third is difficult for an instrument retrieval and may end up in some other procedural errors while attempting the instrument retrieval. And another factor we have to keep in mind is whether the instrument separated is free or embedded in the canal. A free instrument is more easier to remove compared to the embedded instrument. Coming to the first technique, no intervention. Sometimes when the instrument is separated in the apical third, that is at your apex, and the instrument that you have separated has been is a larger size instrument where almost 80% of your cleaning and shaping procedure is over, then you don't have to attempt for an instrument retrieval in case there is no periapical pathosis and the patient is asymptomatic. You can leave the instrument in the canal and obturate the rest of the canal, but you have to always keep in mind that the tooth that has been affected should have no periapical pathosis and the patient should be asymptomatic. When the patient is having a periapical pathosis and the patient is symptomatic, you have to go for an instrument separation management by either bypassing or the retrieval of an instrument. Otherwise, you can go for no intervention and you can leave the instrument in the apic and make sure that the broken instrument has provided the apical seal in the apical third. Coming to the next one, non-surgical approach. Non-surgical approach of instrument separation management will require magnification. Magnification is the key for instrument separation management, and without a magnification is very difficult for the retrieval of the instrument. What are the magnification devices that can be used is a dental operating microscope or a dental loops with adequate illumination capacity. And the different methods of instrument retrieval are bypassing the fractured instrument, mini forceps method, broach and cotton, braiding of the endodontic file, the ultrasonic technique and the microtube removal methods. Coming to the first choice in treatment will be the bypassing the fractured instrument. What is a bypassing of fractured instrument is creating a smaller pathway for the next file to go along the side of the fractured instrument. The first bypass technique is carried out by small hand instruments such as barred brooches, K files or H files that may be inserted inside the canal in an attempt to obtain the purchase in the fluting of the broken file. The first step is to create the canal space corona to the fractured segment with a series of gates, glid and burrs or the piezo reamers in a step back manner. The purpose of this approach is to remove any dentinal barrier to the coronal passage of the fragment after it is being loosened. So, a series of gates, glid or a piezo reamers should be used in a sequential manner. Next, it is absolutely essential fractured segment be bypassed with the smaller size instruments, then going on to a bigger size instrument. Starting with a bigger size instrument will not give you the favorable results of bypassing, so you have to start with the smaller size instrument. This is a case where an IT instrument is separated in the mesiobuccal canal, and you can see the gates, glid and drills or piezo reamers are used to remove any dentinal barrier coronal to the fractured instrument, and then smaller size instrument is used to bypass the instrument and a path is created along the side of the fractured instrument, then continuing with the larger instrument and finally completing the obturation. The last radiograph shows the postoperative image after the bypassing of the fractured instrument. The next technique is the mini forceps. Mini forceps is used mainly when the instrument is clearly visible to you in the naked eye or through magnification. That is especially when the instrument gets fractured in the coronal third or at the orifice, where you can have a hold of your mini forceps or directly to the instrument and then you can pull it out. So, a firm hold of the file, extract it out through the canal preparation. These mini forceps are available in two angulations, that is 45 degree and 90 degree. Depending upon the canal anatomy and the tooth which is fractured, you can select the instrument be it 45 degree or 90 degrees. Coming to broach and cotton technique, when your fractured instrument is a broach, consider your fractured instrument is a broach that you have fractured inside the canal. Use a smaller size broach that is enrolled in a cotton, and then when you put this broach inside, the cotton engages the broken fragment and the fractured broach can be retrieved. Coming to the next technique, that is braiding of files. When an instrument is broken, the space is created adjacent to the fractured instrument with the help of H files with the help of 2 or 3 H files, and the H files are braided around the instrument and then it is pulled out. This is a tricky technique where you can end up in breaking your H files also if not used properly. Coming to the ultrasonic method or the most successful method in retrieving the instrument, there are 3 steps in this ultrasonic method, that is coronal and radicular access, then identifying and exposing the separate instrument, and then performing the ultrasonic trephining procedures. You have to first gain an access from the coronal to the radix, then identify and expose the separated instrument, then perform the ultrasonic trephining procedures. Identifying and exposing the separated instrument head is very important, and after that the ultrasonic instrument which you are having, you have to use it in an anti-clockwise motion so that the file unwinds and pops out. This is a very tricky procedure but a very effective procedure. The movement of the ultrasonic instrument in an anti-clockwise movement is very important in retrieving this instrument. This is more easier in cases of the file being fractured has a straight line access and the file is still in the middle or in the starting of the apical third. Any instrument beyond the curvature is difficult for the retrieval. These are two cases that is performed in our Department of Endodontics in Vinayaka Mission Sankaracharya Dental College and Hospital. The first case is a separated hand file in the distobuccal canal of upper molar. We have retrieved using the Talal's endodontic kit using the ultrasonic procedure, and the second one is a very long instrument which is of about 9 to 10 millimeters in the canine region. The canine has a very long root and the canal is narrower in this case, and this instrument also we have made the coronal and radicular access, then we have used the Talal's endodontic kit and have retrieved the instrument. Coming to the microtube retrieval options, this microtube retrieval option is a very effective method, but it is very effective only when the instrument is loose and the instrument is present only in the coronal or the middle third. It is not effective in cases of apical third or beyond the curvature. There are many techniques of this which follows this microtube principle. They are lasso and anchor method or the wire loop technique, tube and glue method, tap and thread method, spinal tap needle, endo extractor, file removal system, the separated instrument retrieval system and the Maceran kits. These are the kits that are commercially available which will be helpful for the retrieval of instrument that works in the principle of microtube. The wire and loop technique can be made in a clinical practice using your syringe and a smaller size ligature wire, which also can be useful in retrieving the instrument. So this is a basic flow chart how I will go with my treatment plan. Whether the fragment can be bypassed, I will go for a bypass. Then I will create a space alongside the fractured instrument and I will complete my fractured instrument management. If the segment cannot be bypassed, then you have to go for where it is located. If it is located in the apical third, okay, well and good. If there is no apical pathosis or and the patient is asymptomatic, I will continue with the observation and complete my treatment procedure. And in case if it is in the coronal or middle third, then I will look for whether I can access the instrument in a straight line. If there is no straight line access or it is beyond the curvature, I won't attempt my instrument separation retrieval procedure. In case if I have a straight line access, I will go for an attempt to remove my instrument separated using various techniques such as ultrasonic, microtube method, and there are also some complications when you are attempting for your instrument separation removal. The various complications can be root perforations, excessive removal of tooth structure during your ultrasonic trephining process, another secondary fracture of any instrument or a foreign object inside the root canal anatomy, your ultrasonic tip can break, or during the braiding of H files, your H files may break inside the canal, or you may end up during the bypass procedure, you may form a ledge or the transportation of the instrument fragment deeper inside the root canal space, or sometimes when you are attempting for an instrument retrieval in the apical third, you may also end up in pushing the instrument beyond the apex, which will more end up in a questionable prognosis. Coming to the prevention, always it is wiser to prevent an instrument separation rather than managing it. So a proper pre-assessment of the radiograph, proper selection of the instrument, proper discarding of the older instrument is always wiser than to use this ultrasonic microtube methods for the retrieval of an instrument. This prevention will take you 5-10 minutes, whereas your instrument separation retrieval is going to take you hours. So I will always suggest you to go for a preventive method rather than going for an invasive retrieval method. So always look for any deformities in your nickel titanium instrument, and deformities in the nickel titanium files should be discarded, and again reusing the instrument is going to put you in danger. So concluding that The best way to deal with the instrument breakage is by learning the proper techniques, following the manufacturer instructions for the files, and proper management and proper assessment of the radiograph before starting your root canal treatment, and select your rotary files wisely according to the root canal curvature and anatomy, like gold treated files or control memory files or the EDM files. When choosing non-surgical revision of previous root canal procedures, careful assessment and treatment planning with each cases are the cornerstones to success. Prevention is the operative word in the successful usage, and there are also surgical techniques for removal of the fractured instrument. Either you can go for a hemisection or an apicectomy, but always I will suggest you not to go for very invasive procedures. Rather, wait for 5 minutes, check your instrument, what is the status of the instrument, check the manufacturer instructions, whether you have set that speed and torque to the correct manufacturer's instruction, check whether you have a straight line access, and then start your cleaning and shaping procedures. Use appropriate lubricant, irrigate then and there, so that you will have more confident that your instrument separation doesn't happen. That confidence will reflect in the prognosis of the root canal treatment, and you will have more success in your root canal treatment. Thank you everyone for listening to this lecture on instrument separation and management. Thank you.